Good morning, everyone. My name is Kate Sweeney, and I'm with LiveWell, Colorado. I'll be your moderator for today's webinar. And before we get started, I have a few housekeeping items to go over. First of all, we will be recording this webinar, and it will be available beginning tomorrow morning on the LiveWell Colorado website. To access the recording, simply visit livewellcolorado.org, click on the LiveWell's Commitment tab, click on Research and Publications, and then select Webinars. Second, we will have some time for Q&A at the end of the webinar. If possible, please be as specific as possible with your questions, and Mark will be happy to answer those. And without further ado, I'm going to introduce Sandy Stenmark with Kaiser Permanente.
Hi, I'm Sandy Stenmark, a pediatrician with Kaiser Permanente, and I've been working in the area of childhood obesity prevention and treatment for 8 years now, and I'm so excited to introduce Mark DiCamillo, who is a Senior Vice President of the Field Research Corporation. Field Research Corporation, which is one of the nation's oldest and most respected survey research organizations. He is a graduate of Harvard University and received a master's in business administration from Cornell University's Johnson School of Business. Mark has directed hundreds of market and opinion research studies for corporate, foundation, media, government, and institutional clients. Research in the fields of health and obesity prevention represent one of his largest areas of concentration. Today he will be discussing the results of a survey sponsored by Kaiser Permanente, which explored Coloradoans' views regarding the role of both schools and community in preventing childhood obesity. I'm pleased to introduce Mark. Thank you, Mark.
Thank you, Sandy. And I just want to reiterate that our firm, Field Research Corporation, was retained by Kaiser and its agency, Cause Communications, to conduct this survey. The survey was actually conducted in Colorado, as well as selected other states around the United States, and also included a U.S. nationwide sample. But today, I'm going to be just discussing the results that we retrieved from the Colorado sample. They're not all that different, by the way, from the nationwide sample, so there were, I'd point them out. And again, the main objective of the survey was to assess public opinion about the problem of obesity among kids and teens in the U.S. and to assess the role that schools could play in obesity reduction efforts. The survey in Colorado included interviews with a random sample of 326 Colorado adults. This was done by telephone in English and Spanish. The interviewing dates were March 5th through April 14th, 2013. All of the survey interviews were conducted from Field Research Corporation's central location call center. It happens to be in San Diego, California, by professionally trained interviewers, so everything was under our control from beginning to end. Okay, let's begin with some of the results. Table 1A summarizes the survey results when we asked the question, how serious do you believe the overall problem of obesity is in the United States? And then how serious do you believe the problem of obesity is among children and teens in the United States? So you can see we get very similar results from Colorado residents to both questions. Over 90% say it's a serious problem, with about 6 in 10 or so saying it's a very serious problem. And if we look at the next slide on Table 1B, you will see some of the subgroup findings to the second question about the seriousness of obesity among children and teens. And not a lot of variation, as you can see. Parents pretty similar in their overall answers to those of adults in total, which are at the top. We compare race and ethnic subgroups, just the white non-Hispanic population versus the ethnic population, and also men and women. One thing that is significant, you can see that on the women answers, a somewhat larger proportion say that they believe the problem is very serious compared to men. It's 63% compared to 50%. That's a statistically significant difference. Okay, next slide. Okay, the next slide, Table 2, shows the results of two different questions when we're asking Coloradans to just give a grade to their own community's efforts in attempting to reduce obesity among residents, and then also give a grade to their own local public schools in the efforts they're doing to reduce obesity among their students. And the first finding, let's look at the left-hand side first. When we're looking at the results from the community overall, you can see the results aren't that great. In fact, 32%, about 1 out of 3 of all Colorado residents give their own community a D or an F in that assessment. Just 26% give an A or B, so more actually give a failing grade than give a positive grade. Another third or so give a C, kind of middle-of-the-road grade. These results are not that different from the nationwide results when we're asking all U.S. residents to say this, so it's not as if Colorado communities are any different, really, than the rest of the country on this question. One hopeful sign, though, is that the assessments that Colorado residents give to their local schools is somewhat more positive. 36% give an A or a B grade to the job that their local schools are doing in obesity reduction efforts, and a smaller proportion give a failing grade, just 21%, that's 14 and 7, give a D or an F. There is a somewhat larger chunk of people who aren't able to assess the schools, but still a more positive assessment to the schools than to the general community overall. Next slide. Okay, the next slide asks a question about whether obesity is a personal issue that people and their families should be dealing with on their own, or whether it's also a problem that community groups and organizations should also have some responsibility and take some involvement. And you can see that when we ask it in that form, most people think that community groups should be involved. Just 23% say that it should only be a personal or family issue. So there is a sentiment for community involvement. Next slide, please. Then, as you can see, the community involvement by subgroups, pretty much large majorities across all subgroups think the community should be involved. Again, slightly larger proportion of women who are, again, view this problem as a little more serious. They're more likely than men to say that the community group should be involved. Next slide. Okay, here is a slide which summarizes a number of different questions that we asked on the survey. We went through these 8 different categories and asked Colorado residents, what role do you think this group should play in obesity reduction efforts in your community? And so, for example, we asked about the local public schools. What role should it play? Should it play a major role, a minor role, or no role? And we went through the whole list of 8 different community groups to see what the answers we would get. And here they are, kind of arrayed in rank order. At the top of the list are the local public schools. Most people believe, almost 9 out of 10 believe they should have a role in obesity reduction efforts. Just 11% say no role. And when you look at the subgroups that are saying major role, it's a large majority. 60% think the K-12 schools should be playing a major role in obesity reduction efforts. Just 29% minor role, and that adds to the 89%. You look at the other 7 groups that we measured, the next highest that Colorado residents believe should be involved are food and beverage companies themselves. 82% think they should be playing a role, with about half saying a major role, about a third saying a minor role. Local community and civic organizations, about 3 out of 4 think they should be involved, either major or minor role. Restaurants, also 3 out of 4, although the proportion saying major role starts to go down to 29%. Food retailers, about 3 out of 4 also say they should be playing a role, with about half of them saying major, half of them saying minor. And then at the bottom are the three that had the smallest proportions saying they should be playing a role, although even here, majorities say they should have some role: employers, government, church, and faith-based organizations. And it's interesting that government is rated on the low end of the scale, and just 28% of Colorado residents believe government should be playing a major role in this effort. All right, the next slide, please. Now we're going to focus in on the top one, which is the local public schools, and which we're going to be talking a little more about in the rest of this presentation. You can see that I'm re-summarizing the results. 60% say that K-12 schools should be playing a major role, 29% a minor role. And when you look across subgroups, the segments of the public pretty much are in agreement. Over 80% or more are saying that it should be playing a role. Actually, white non-Hispanics tend to say that a little more than the Latino and African American and Asian Americans in the survey. And women are a little more likely than men to say that they should be playing a role, actually a little more likely to be saying that they should be playing a major role. Okay, next slide. Okay, then we asked the public to react to the new USDA school nutrition standards for meals served to students in school. And let me read you the description that was included in the question, and then we asked people did they favor or oppose that. The new rules require the schools to serve low or non-fat milk instead of whole milk, reduce the amount of salt and saturated fats in meals, offer more whole grain food choices, establish age-based calorie limits in portion sizes, and require students to select a fruit or vegetable in their meal offering. So when we presented that summary of the new USDA school nutrition standards, we asked people did they favor or oppose that. And here you can see there's just very broad-based support. 84% are in favor, just 13% are opposed, and then we asked those in favor if they favor it strongly or somewhat. 62% favor the new standards strongly. So very strong support, and again, this is very consistent with what we found nationwide. Next slide. And here again, across the subgroups of the population, not a lot of difference. The women, again, slightly more likely than the men to be strongly supportive. Again, they're the ones who think the problem is most serious. Okay, next slide. We then also asked a second question that talked about applying the new USDA nutrition standards to foods that kids can buy in school other than at mealtime. And by this, we meant foods that were sold in school snack bars, school stores, and when selling individual food items in school cafeterias. And on this item, you can see also very broad-based support. 72% are in favor of applying the new USDA nutrition standards to foods that kids can buy other than at mealtime. 25% are opposed. Most of the people who are in favor do so strongly. Okay, next slide. And when we look at this by subgroup, the same kind of topology, not a lot of variation across subgroups. The women slightly more likely to be in support than the men. Next slide. Okay, this table looks at the importance of various actions that the K-12 schools can take to encourage kids to eat healthier and to make healthier food choices. And we read a series of, I believe there are 6 different actions that the schools could take. This slide shows the first 3, and we are arraying them in kind of rank order. The ones that get the highest importance are shown at the top, and we'll move down the list. So the one item that nearly every Coloradan believes is highly important. And again, this question was asked on a 10-point scale. How important is this on a scale of 1 to 10? Highly important are those people who gave it a rating of 8, 9, or 10. Moderately important, which is shown on the right, gave it a rating of 5, 6, or 7. So actually, when you add those two numbers together, you'll see that very few people rate any of these things as of low importance. It's just how highly important are they. Okay, the one that strikes us as the most important, clearly, both in Colorado and nationwide, make fresh, clean drinking water freely available to kids in schools. About 9 out of 10, both adults and parents, believe that's highly important. Expand school nutrition education to teach kids the benefits of healthy eating, help them identify which foods are healthy and which are not. About 3 out of 4 parents and adults think that's highly important. And then about 2 out of 3 say encourage the use of healthy food and beverages for school celebrations. Both parents and adults, 2/3 of them believe that's highly important. Next slide. And as we continue on for the other items that were read in this same series, eliminate unhealthy food and drink options from school vending machines. About 2 out of 3 Coloradans believe that's highly important. Create a breakfast in the classroom program, offering kids a nutritious breakfast during the first 10 to 15 minutes of class time. About half of the public in Colorado believe that's highly important. Stop using food and candy as a student reward in school. Slightly higher proportion, majority, give that as a highly important thing to do. Stop selling junk foods and candy as part of school fundraisers. About half, a little more than half of parents believe that's highly important. Okay, the next slide. Now, the next slide also assesses the relative importance of things that the schools can be doing. This list, however, talks about things that the schools could be doing to encourage kids to be more physically active while they're in school. And so here again, we're going to show the items that we rated, and we're arraying them again in rank order from the ones that are most important at the top as we go down the list. Provide kids more opportunities to be physically active during recess. Greater than 8 out of 10 Colorado residents believe that's highly important. Require daily physical education classes for students in all grades. About 3 out of 4 of Colorado residents believe that's highly important. Keep playgrounds, multipurpose rooms, athletic facilities open during non-school hours. About 2 out of 3 believe that's highly important. Integrate more physical activity breaks during daily classroom instructions. Again, another 2 out of 3 or so consider that highly important. And then increase opportunities for kids to walk and bike to school. A majority, 57%, believe that's highly important. Okay, next slide. Okay, Table 9 focuses in on the building of more sidewalks, paths, trails, and bike lanes in the community to enable more kids to walk and bike to school, whether they favor or oppose that idea. And as you can see, both parents and adults pretty much react the same way. They're quite supportive. Among all adults, 80% are in favor. Just 19% are opposed. Next slide. Okay, we're talking here about specific actions that the schools could take to encourage kids to walk and bike to school. So what are the things that the schools might be doing to stimulate that and to encourage more kids to do these kinds of things? All right, the first was, and we asked people on this particular set of questions, how helpful do they feel this particular item would be in encouraging kids to more kids to walk and bike to school. So the first one, organizing groups called walking buses or bicycle trains, where students can walk and bike together to school under the supervision of a parent. That gets a very positive reception, with about 9 out of 10 believing that that would be helpful, and about 6 out of 10 saying it would be very helpful. So that's the one that seems to get the highest score. And the next one, provide education programs to instruct kids on safe walking and biking practices. Again, over 80% believe that would be helpful, but the proportion who say this is very helpful starts to decline a bit, about half saying it would be very helpful, about half saying it would be somewhat helpful. Conduct an audit of safe walking and biking routes to school, and distribute maps to kids and their parents. How helpful would that be? Again, about 8 out of 10 believe that would be of some help, 45% of all adults saying it would be very helpful, 39% somewhat helpful. Okay, next slide. We asked a question about the effect of kids eating healthier foods in schools on their academic performance. What are the opinions of Colorado residents about that? And the scale that we asked, do you think this will increase their academic performance, have no effect, or decrease their academic performance? And most people think it'll have a positive effect, not only on their health of the child, but also on academic performance. About 3 out of 4 see this as improving or increasing academic performance. Next slide. And then we also asked the same question about what about the idea of having devoting more time for kids in school to be doing physically active, and to get more exercise during regular school hours. So this is not just after school, but during regular school hours, trying to get kids to be more physically active. What effect would this have on academic performance? So this is an interesting finding, because many, criticisms of doing more physical activity during school hours is that you're actually taking away from your academic time. But here you see that actually having kids be more physically active, most of the public, and this is consistent with the nationwide public as well, think this will actually increase academic performance. So there's a positive benefit to this in and of itself, to just do more, to make sure the kids are getting more exercise and being more physically active during their school hours. Okay, next slide. Okay, on the next 3 slides, what I'm going to be showing are Colorado residents, their stated willingness to take actions to change their own behaviors to reduce obesity and adopt a healthier lifestyle. After this slide, I'll be talking about their willingness to take actions to change the behaviors of their loved ones in the same thing, to reduce obesity and adopt healthier lifestyles, and then also their stated willingness to take actions in their community to help reduce obesity among residents in the overall community. So again, first let's look at their willingness to take actions to change their own behaviors. There's a lot of stated willingness, good intentions here, of people saying they're willing to do these things. That's the first takeaway. All of them get nearly 90% saying that they're at least somewhat willing to do these, and large majorities, in most cases, say that they're very willing to do these things. So the first one is modify your diet to include healthier foods and reduce the unhealthy foods and beverages that you consume. 65% say they're very willing to do that. 27% of Colorado residents somewhat willing. Increase physical activity to include more walking and exercise. 70% say they're very willing to do that. Another 25% say somewhat willing. Talk to your doctor about ways to achieve your own personal weight goals. 63% are willing to do that, very willing. 27% somewhat willing. Reduce how much you eat at mealtime and between meals. Again, 56% say they have good intentions on that. Whether they can follow through is another thing, but there's a lot of stated willingness to do these things in terms of taking actions to change their own behaviors. Okay, the next slide. And you can see the takeaway from this slide, the same kind of thing, very high stated willingness to take actions, this time to affect the behaviors of loved ones. So let's go down the list, but again, large majorities saying they're very or somewhat willing to do these things, with the majorities pretty much saying they're very willing to do these things. Encourage their loved ones to increase their physical activity to include more walking and exercise. 74% are very willing to do that, 20% somewhat willing. And here again, parents, because most of the loved ones that I assume they're thinking of are their kids, they're a little more likely to be very willing to do that. Encourage them to modify their diet to include healthier foods and reduce their consumption of unhealthy foods and beverages. 64% of all adults very willing to do that, 27% somewhat willing. Again, parents a little more likely. Set aside time to do physical activities together, like walking and exercise. Very large majority, 72%, very willing to do that, 22% somewhat willing. Parents a little more likely, again. Encourage your loved ones to talk to their doctors to achieve their own personal weight goals. 59% say they're very willing to do that, 29% somewhat willing. And the next slide. Okay, and this is the final slide, and then I'll give you a little summary of recap of the findings. But here is the stated willingness of Colorado residents to support community actions to reduce obesity and encourage healthy lifestyles among local residents. So these are things, community actions that the public can take to try to reduce obesity in their own community. The one at the top, support efforts to provide more places to walk and bike in their community. About 9 out of 10 are very or somewhat willing to support that, with 49% of adults and 55% of parents very willing to do that. Support restaurants, food retailers who display calorie information and the amounts of sugar, fats in their menus or at grocery stores. About 8 out of 10 are very or somewhat willing to do that, with 45% of the adults and 46% of the parents very willing to do that. Volunteer to help at local schools, community organizations in obesity prevention efforts. Here you get about 3 out of 4 saying they're willing to do that, but only about 1 out of 3 or so saying they're very willing to do that. Share your opinions about the importance of obesity prevention with elected officials. Similar kind of distribution to that question. About 3 out of 4 saying they're very or somewhat willing, with about a little more than a third saying they're very willing. So let me just give you a brief summary of what I just went through, and then we can open it up for your questions or comments at the end. Okay, the first takeaway is that nearly all Colorado residents view obesity as a serious problem, both overall and among children and teens, and with majorities describing the problem as very serious. Colorado residents give relatively low grades to their own community's efforts in reducing obesity. However, the local K-12 schools are given somewhat more positive ratings for the efforts that they're doing. There's a strong belief among Coloradans that community organizations and groups outside the family should be involved in obesity reduction efforts, and that obesity shouldn't be left to individuals and families to resolve on their own. And when asked to assess the roles that 8 different community groups could play in obesity reduction efforts, the largest proportions of Colorado residents believe that the K-12 schools should be playing a lead role than any other group or organization. The new USDA school and nutrition standards applicable to meals served to students in schools are broadly endorsed by large majorities of Colorado residents, and there's also strong support for extending those standards to foods that kids can buy at school other than at mealtime. Colorado residents attach high importance to a wide range of actions the schools could take to encourage kids to eat healthier and to be more physically active. Most believe that if the schools were to take these actions, they would have a positive impact on student academic performance. And there is broad-based support for policies aimed at building more sidewalks, paths, trails, and bike lanes in local communities to encourage more kids to walk and bike to school. Colorado residents also offer high degrees of a stated willingness to take actions to reduce obesity in their own lives, in the lives of their loved ones, and with relatively large proportions saying that they are also willing to take community actions that would help reduce obesity among residents in their communities, with about a third or so very willing to take those actions. So those are generally the findings that we retrieved from the Colorado survey. Again, most of those findings coincide with the results that we found in the nationwide sample as well. So let me turn it over back to Kate, and we can start taking your questions.
Thank you so much for presenting that information, Mark. Like I said, it's very simple to ask your questions. Mark's happy to answer anything. Simply type your question into your question box on your on-screen control panel, and please be as specific as possible so we can reference the graph that you had your question on. So we've received a couple questions so far. The first refers to Table 4A, and was this question asked specifically on reducing obesity among children?
Okay, this was a question. Let me go back to the actual questionnaire, and I should be able to answer that directly, but I believe it was asked about public overall. Right. This question, when we're asking about what roles that community groups should be playing in reducing obesity, was asked in a general way to address the issue of obesity in your community. It wasn't specific to kids and teens.
Okay, great, thank you. Our second question, I think, pertains to this same slide. It said, did they specify public health or just government as a whole when asking about their involvement in obesity prevention?
That's a good question, and it's one that we've actually polled on in a number of different surveys in different ways. In this survey, it was only asked as the term government. In fact, the words you see on your screen are the way each item was posed to the respondent. However, we have done surveys of different populations trying to assess, the role that the federal government could take, or the role that the state government could take, or the role that local governments could take. And actually, once we also included the public health, your local public health department, to see if that kind of improved response, got a higher response. And unfortunately, and this has to do with generalized views, I think, of government these days, most of those different descriptions had no real effect, that you still get this relatively modest proportion, and it's certainly lower than the other categories above it, at least at the top end of the scale, the schools, the food and beverage companies, local community and civic organizations, and restaurants and food retailers. Those five, it doesn't matter what population we interview, and it doesn't matter how we describe government, those 5 still get higher ratings or higher involvement from the public, and Colorado residents are no different here than when you pose the issue of government. And a lot of that, just to comment a little more about it, when you raise the role of government to people in surveys, what you end up tapping into are very generalized views that can have a very partisan cast. Now, obesity is an issue that actually is one where, as you can see from the findings, that there really isn't a lot of partisanship on these issues because there's consensus about these issues, generally speaking, that very large majorities are supportive. And when large majorities are supportive, you're not getting, big differences between Democrats and Republicans by definition. But when you start getting smaller proportions, like you're only seeing 28% saying that government should be playing a major role, you should expect, and you do see, very big differences between voters who identify themselves as Democrats versus those who identify as Republicans. And the Republicans are the least likely group to believe that the government should be playing a role. And again, that goes through all of the various descriptions of government that we try to pose, that we've tried to pose in the past on this. So it's an interesting phenomenon. It's something we've discussed when presenting the findings to national audiences. So I'm not surprised that, again, we got a question about that here. And if there's kind of something that's somewhat discouraging from the poll findings, I think this is one of those things that is a little you should be cautious about, because it does kind of raise the specter of partisanship into the debate. And again, this is one of the issues that really doesn't carry a lot of partisan difference in public attitudes.
Great. Our third question is, how do people define minor role?
It's whatever they say. I mean, on any of a poll question, it is what it is. And so the interpretation is left into the respondent's own, interpretation. And if they ask our interviewer, well, how do you define major and how do you define minor, they are instructed to play back to the respondent, well, it's whatever you think they mean. That's literally all they can say. They are not instructed to give any definition whatsoever, so that all the interviews are conducted in the same manner. So the actual question, I'll just read it to you. For each of the following groups and organizations, please tell me whether you feel they should play a major role, a minor role, or no role in helping to address the issue of obesity in your community. And then we start in a random order, so they're not read in any particular order. Should government be playing a major role, a minor role, or no role? Should the local K-12 schools be playing a major role, a minor role, or no role? Should the restaurants be playing a major, and so on, for all 8 of the different categories? And again, we just arrayed the results in rank order. So it is what it is. That's about all I can say.
Okay, great. Now we have another question. Did the sample include adults with cell phones only?
Oh, yes. We interviewed a large number of the interviews were conducted with people on their cell phones. You have to do that these days. The way in which adult samples of the population are done actually are with 2 concurrent samples. One are done with random digit listings of phone numbers that are assigned to just regular landline home phones, and then a second sample of phone numbers, random numbers that come out of all of the prefixes and area codes of telephone numbers that are assigned to cell phone banks. So and then there are different prefixes are assigned to each. So we basically are randomly dialing these numbers. We're looking for households in the case of a landline listing. We're looking for individuals, and then obviously screening for adults when we reach somebody on their cell phone. But yes, a large proportion. I believe it was almost half of the interviews were done with people on their cell phones. And what's happening in society today, as you may well be aware, the latest statistics from the government surveys that are monitoring the use of cell phones versus the use of landlines in the United States, over 90% of all U.S. adults now has a cell phone. It's incredible how fast that proportion has risen. It's almost universal. And now, as that has happened, the proportion of people who only have a landline phone is only about 65%. So that number is going down year by year. So the cell phone portion of the sample, I believe, is becoming increasingly important to any telephone survey that you do among the American public.
Mark, this is Leslie. I am a colleague of Kate's. And the question about the cell phones, do you have any way of knowing that the people who are surveyed via cell phone, if that is their only accesses through cell phones? Because we definitely see lower income populations only having cell phones versus those who are maybe single people who they just choose not to have a landline.
Right. No, that's a good question. And what we do when we're doing these surveys is we typically have a question when we reach them to find out how do they make and receive most of their personal calls. And we then give them a scale. Do they receive all or most of them on their cell phone? Do they receive about half of their calls on a cell phone and half on a landline? Or do they receive all or most of their calls on a landline? And so what we're able to do through the answers to that question, we can identify the populations that, again, are receiving all or most of their calls on a cell. We can identify the population who are receiving all or most of their calls on a landline. And then there's that middle group that are getting half and half. And that group, because they can be in both samples, actually gets weighted down a little in terms of their the likelihood of contacting them is a little greater because, again, they could have appeared on a landline sample. They could have appeared on a cell phone sample. Their responses get weighted down just a bit. What we're trying to do is to merge these two samples into one, and that's how that's done statistically.
Mark, this is Sandy Stenmark. I wanted to ask you, how do you jive the fact that 59% of public opinion is strongly in favor of building more sidewalk and paths for children to be able to walk or bike to school, yet there's the fear of having government have more of a role?
Yeah, well, I know. Some of again, I tend to think that when you raise the term government to people, it sets off kind of a partisan flag in their head. So that's just common to public opinion research. However, when you start asking specific things that the government does and whether they support, building highways or in doing this or that, there's strong support, and there's no such partisan gap. So it really goes to political attitudes and the role that government plays in society. In our increasingly kind of partisan framework through which everything seems to be funneled, at least in Washington, or I don't know what the Colorado State House is like. Out here in California, it's a very partisan orientation as well. And it has to do with the media. There seems to be a Democratic TV station, a Republican TV station. There's not as much of a consensus TV station anymore. There's no more Walter Cronkite. So you really have this kind of backdrop in which most public issues are viewed through a partisan lens. And that's just a fact of political life these days. I wish it weren't. But whenever we raise the role of government as a generic, you get these very partisan reactions, and with the Republicans generally taking a very limited a view of the role of government. But again, it's not to say that Republicans aren't supportive of building things that they think would help their communities. And I think that's the job of public opinion research as well, is to identify those things and to then try to convince legislators and you know, the powers that be that there is support for doing these individual actions, even though it may be perceived as a expanded role of government. So you try to avoid that debate, but talk about the specific, and I think you're on safer ground there.
Thanks.
And now on a more broad level, I think you alluded to it a couple times during the presentation, but we got a question. Are results from Colorado significantly different from other states on any of these issues?
Not a lot. I thought, you know, one of the interesting things about Colorado, you know, the other areas that we surveyed, by the way, we did a sample of Californians, which I'm very familiar with. A lot of the surveys that field research does is right here in our backyard of California. And we also included a sample of residents of Oregon and Washington, and also a sample of the greater Washington, D.C. area. Kaiser basically was the one telling us where they wanted to kind of examine in a little more detail, and those were the 4 areas besides the U.S. public overall that they wanted us to focus in on. One of the things about Colorado is, especially compared to the other 3 areas that we polled, the other states that we polled, Colorado residents actually, a larger proportion, identify themselves as Republicans. And so it actually serves as a good demonstration of the fact that because we're not really seeing statistically significant differences between Colorado residents and the rest of the nationwide public, or when you compare it state to state, it demonstrates that there really isn't a lot of partisanship going on this issue. If we were to poll other issues, and for example, comparing Colorado to California, or Colorado to the greater D.C. area, or Colorado to the Pacific Northwest, I'm sure you would find large differences on social attitudes between what Colorado residents think and feel, with a somewhat more conservative bent to their views and opinions compared to the other 3 areas, especially California. So I thought, you know, that's an interesting finding. The lack of difference is a finding, and so I think that's something that needs to be taken away. There were some small differences that we pointed out in our report, but they're fairly minor. We're talking about differences of 6 or 7 points between the nationwide findings and the Colorado findings on several of the items, but nothing really major jumps out.
Okay. Thank you so much, Mark. For our participants to ask you questions, I know is very, very helpful. And if you do have any last-minute questions, please enter them into the question box of your control panel. I would like to repeat that today's webinar is being recorded, and it will be available tomorrow on the LiveWell Colorado's website. To access the recording, simply go to livewellcolorado.org, click on the LiveWell Commitment tab, click on Research and Publications, and then Webinars. And along with the recording of the webinar, there will be a PDF of this PowerPoint presentation. We did receive another question. Mark, do you ask just Republican or Democratic, or also independent?
Well, no, we certainly ask people their party affiliation, and there are a large segment of the public that identifies as independents, and certainly that's there. It's asked in a very standard way. The actual question, generally speaking, do you usually think of yourself as a Republican, a Democrat, an independent, or what? That's the general question. So it gets, you know, it's a very broad definition, and again, we get very different results when we ask that question in Colorado than when we ask that question in California or in the greater D.C. area in particular. Okay?
I might just give a couple more minutes to see if we have any last questions. If you don't think of any questions right now, but later today or before you go to bed tonight, some question pops into your head, Mark has been kindly enough to offer his email address, and it's posted up on the screen, markd@field.com. Okay, it looks like we're all done with questions. Mark, thank you so much for joining us today, and to all the participants for taking the time to listen in on our webinar. Thank you.